You know, debilitating back pain can feel like a life sentence, right? But what if the solution wasn't about managing the pain, but fixing the break with cement? Yeah, you heard me right. Today, we're going to dive into a pretty wild medical procedure called vertebroplasty. And look, we're not talking about a minor ache here. The study we're digging into today from the Tantama Medical Journal calls this severe and incapacitating. That's medical speak for pain that doesn't just hurt, it completely hijacks your life. So yeah, finding a real solution is absolutely critical. Which brings us to the big question, one that honestly sounds like it's straight out of science fiction. Can you really fix a broken spine with cement? Well, we're going to follow the science from this study and find out exactly what it says. All right, so first things first, we need to understand the enemy. What is this crippling spinal problem we're actually trying to solve here? Okay, so the official name is a vertebral compression fracture, or VCF for short. And let's be clear, this isn't just a simple crack in the bone. We're talking about a full-on collapse of one of the bones in your spine. And the consequences? They're brutal. We're talking chronic pain, a total loss of function. It can completely impair your quality of life. So now that we know just how serious the problem is, let's get to the good part, the innovative solution this study looked into. What exactly is vertebroplasty? Well, that's vertebroplasty, or VP. In the simplest terms, it's a minimally invasive procedure where surgeons inject a special medical cement right into that fractured vertebra. The best way to think about it, it's like giving the bone an internal cast. It stabilizes the whole thing from the inside out. Pretty clever, right? Okay, I know what you're thinking. Injecting cement into someone's spine, that sounds incredibly complicated and maybe a little terrifying. So how do they actually do it? Let's break down how the procedure works. It really boils down to three main steps. First up is navigation. The surgeons use something called a C-arm fluoroscopy, which is basically a live X-ray, to pinpoint the exact spot. Next comes the needle placement. A hollow needle is super carefully guided right into the fractured vertebra. And then, step 3, the injection. That special bone cement goes through the needle, filling in all the cracks. Simple in concept, but so precise in execution. And boom, here's the payoff. This image shows it all. The cement hardens in just a few minutes, stabilizing that fracture from the inside. It's an instant internal fix. Okay, the whole idea is impressive, for sure. But here's the billion-dollar question, right? Does it actually work? Let's get into the key results from the study and see what the data tells us. So the study we're looking at followed 30 adult patients who all underwent this procedure. And these weren't just data points. These were real people suffering from those exact painful spinal lesions we've been talking about. Check this out. This first result is all about getting your independence back. Before the procedure, a whopping 93% of these patients needed a back brace just to get by. And after, that number dropped to less than 7%. I mean, wow, that is a massive life-changing difference. But okay, what about the pain itself? This chart tells a pretty incredible story. Take a look at the severe pain group. Before the procedure, that was almost 17% of patients. After, it's down to just over 3%. But here's the real kicker, the mild pain group. After the procedure, that number jumped to over 83% of patients. That's a huge shift from debilitating pain to manageable, mild pain. And to put a human face on these numbers, here's a case study. This is a 42-year-old guy's cervical spine. Image A is before, B is after. You can literally see the physical change that led to those amazing pain reduction stats we just saw. Now, the study also used a tool called the Oswestry Disability Index, or ODI. It sounds complicated, but it's not. It's just a score that measures how much your back pain is messing with your daily life. You know, simple things like walking, lifting, or even just sleeping. A lower score is what you want. It means less disability. So what were the results? Well, over 93% of the patients ended up with good or excellent outcomes based on their ODI scores. And think about what that means. It's not just about being in less pain. It means they actually got their lives back. They could function again. And here's another quick example, a 55-year-old woman's lumbar spine. Again, just look at the difference between the before and after. This really drives home that we're not just talking about data on a chart. We're talking about real people whose lives were totally transformed. Okay, so the results are obviously fantastic, but no medical procedure is perfect, right? We have to be thorough and weigh the risks. So how safe is this, really?
The study reported a complication rate of 6.67%.
But hold on, that number needs some context. The main complication they saw was some minor cement leakage. And here's the crucial part. The study reported no major or permanent complications. Zero. That's really the headline here.
And it's not like this is left up to chance. Surgeons have a whole toolkit to manage this risk. They're using that high-res live imaging. They use a special cement that shows up really clearly on the x-ray. They're watching from all different angles, and they're ready to stop the injection at the very first sign of any leak. They are on top of it.
All right, so we've looked at the problem, the procedure, the amazing results, and the risks. Let's bring it all home. What's the final verdict from this study? You know what? I think the study's own conclusion says it best. Vertebroplasty resulted in less pain, less need for bracing, and a huge improvement in their disability scores, all with a low rate of complications. The takeaway is pretty clear. It seems to be a safe and really effective treatment. When you step back and think about it, this whole procedure shows how a really creative, kind of out-of-the-box idea, an internal cast made of cement, can solve a truly awful, debilitating problem. And it kind of makes you wonder, doesn't it? What other huge medical challenges are out there, just waiting for someone to come along and look at them from a completely different angle?